Family planning, or birth spacing, as we may call it, is critical in human development, poverty eradication, sustainability in all aspects of life. It is critical for the health of the mother, for the health of the child, and the health of the entire family.
It's a well-established fact that if women don't get pregnant, they are unlikely to die from childbirth. So we want to prevent unnecessary maternal deaths and morbidity. It is just wise for us to try to prevent those births that are not needed.
For the young ones, the adolescents, an unplanned pregnancy will definitely derail that young girl from achieving her desired goal in the future.
Maternal mortality rates are still unacceptably high, especially in Nigeria, but it has also been noticed that with family planning, maternal mortality can be reduced by as much as 44%.
Before this year I came in, we have been facing so many challenges. One of the challenges is behavioral change, mis and misconception of family planning. Before now, you cannot just go to a household and see them that I want to discuss about family planning. It's like a taboo.
The women were afraid. They don't even come. They will say, my husband will not accept.
Before now, it's rare for you to hear anybody in the health space come openly to talk about an adolescent taking up family planning methods.
We used to have this problem of teenage pregnancy in this community, Akwajo. We see them committing abortion and they die.
We had a family planning advocacy working group, but it was not that viable.
We are not really motivated or mobilized to really go out to get to the places we desire to go.
We didn't really have a lot of partner support in the family planning space. When TCI came on board, they came on board with what they called business unusual approach, where they tried to ensure that the state was really part and parcel of what they were doing. It wasn't just what they wanted to do for us, it was what the state had need for that they were able to work with.
They started with capacity building. After the capacity building, they support us as much as they can.
They came, they built our capacity as SBCC. We now have strategic plan. We have more direction than what we used to have. And we are more visible. We've seen so much transformation since the inception of TCI, and we're happy for it.
Another thing TCI introduced is what is called whole site orientation. When somebody brings in an idea and it's so good, you're wondering, how did you even manage without the idea? That the facility, the members of the facility will sit down together and everybody is aware of the services that are offered in that facility. And that's one of the things TCI has brought that is very, very significant.
I want to commend TCI because for the first time in the state, TCI was able to bring all the partners together to draw up a plan for family planning in the state. And that document today is a working document for the state. And TCI has also helped to push the agenda of ownership. The board is spending a lot more than we were spending before in family planning because of the approach of TCI. TCI has been one of the major contributors to improvement of the quality of our data. They are always there to support us. And their style of implementation is worth commending because they use the bottom-up approach.
TCI also helped us to know that working at one team made us to achieve more. So that collaboration between different thematic areas has brought us a long way.
They came on board with a lot of high-impact interventions. We began to run with it, and we saw that there was a lot of improvement in our utilization of services. Before we were really into outreaches, but we also added the in-reaches as part of the high-impact interventions that we now provide. We also had the 72 hours makeover, where TCI was able to renovate some of our facilities within 72 hours.
The chairs you see now, TCI made it possible. These tables, most of the things we are using now is being provided by TCI, and the patients are a little bit more comfortable. The privacy level is higher. It has really improved our way of working.
There has been a lot of communications through our various mosques, through our chief imams. The response since then has been very, very encouraging.
They train us on what is called smart advocacy. With that, we are able to advocate to religious leaders, traditional rulers, politicians, and people in authority about the importance of family planning. So that advocacy training that TCI gave us was very, very important, and it helped us a lot.
Once in a while, we carry out review meetings to hear from us our challenges, our progress. Periodically, they come for supportive supervision.
So each of the facility now, they have what they call the quality improvement team, where people come to the facility and then they'll be able to identify things that are not working well in the facility and then things that are working in the facilities.
So family planning today and yesterday, not the same. We have gone far. It's now an household name.
Before they came on board, our met figure in this state was 35%. As I speak, it has come down to about 23%. The modern contraceptive prevalence rate was about 18. As I speak, it has appreciated to 19.6.
It helped us raise our bars in terms of reaching a target for quality of services. This has been excellent in the space.
Before, we don't have a budget line for family planning, which had been one of the things the primary for. But with the family planning advocacy working group, we have a budget line for family planning. So no more crying again about funding. In all the communities they've worked, they've been able to raise champions to talk of family planning. Since they started, our uptake has really surged more than what it was. People are visiting the facilities and accepting. Even our adolescents are not left out in it also. And that's why adolescent pregnancy has reduced.
It was very, very easy and nice working with them. And the statistics of family planning improvement on the whole was quite high. So it means that they were quite effective. In terms of training, we got our own people to learn how to market family planning. They actually did more than family planning. They were involved with us in almost all kinds of planning. Everything we were doing was quite impactful.
Why I start the family planning is I don't want to give birth again because the 4 kids is okay for me so that I can able to train them and it favors me. They have not disappointed me. I'm good for it, and I'm encouraging my fellow women. Let them join for the family planning. It's good for the women.
We always say that TCI is business unusual. It's not just a funky mantra, but really TCI is business unusual across many frontiers. The first is that unlike many development programs where the programs are designed and taken to the states or taken to the beneficiaries, TCI implements a co-creation model where government will have to demand for technical assistance. They will have to demonstrate that they have a need. They'll have to demonstrate that they have the readiness for impact. They'll also have to demonstrate that they have the financial capability and commitment to actually lead and drive implementation. The second thing is that under the TCI partnership, the state government lead and drive implementation. Another thing that makes us very unique is that we use real-time data for decision making. So these are some of the things that make TCI business unusual.